Hello, my name is Joseph Gerbel. I'm a baccalaureate student at Indiana State University. I've created this short presentation regarding hypertension education for my community health nursing class. Population at risk is pre-hypertensive, hypertensive, and people with risk factors for hypertension. After watching this presentation, viewers will be able to identify hypertension, differentiate causes of hypertension, recognize manifestations of hypertension, identify care for hypertension. We will review what is hypertension, normal regulation of blood pressure, etiology and pathophysiology of hypertension, clinical manifestations, complications, diagnostic studies, as well as care for hypertension. Before we go any further, please pause this presentation and click the link below the video. I've developed a short pretest to assess your current knowledge about hypertension. What is hypertension? Hypertension is defined as a persistent systolic blood pressure of 140 or more, diastolic blood pressure of 90 or more, or current use of antihypertensive medications. Blood pressure is the measurement of force on the walls of the blood vessel. Systolic BP is the force while the left ventricle is contracting, while diastolic blood pressure is the force while it's filling. Hypertension is known as a modifiable risk factor to cardiovascular disease. Increased blood pressure, especially for a prolonged period, increases risk of heart attack, heart failure, stroke, and kidney disease. Approximately 1/3 of Americans have high blood pressure. The normal regulation of blood pressure. Cardiac output is a measurement of blood flow through the body's circulatory system per minute. Systemic vascular resistance, or SVR, is the resistance this blood meets within the circulatory system. As vessels narrow, the SVR increases. The opposite is true when the vessels open up, the SVR decreases, allowing for easier flowing blood. Blood pressure is regulated by effects on either the cardiac output, systemic vascular resistance, or both. The sympathetic nervous system and vessels make short-term adjustments to blood pressure, while the kidneys and hormones make more long-term adjustments by adjusting resistance and volume of blood. These changes are made frequently to keep a stable blood pressure that reacts quickly with the needs of the body. Baroreceptors measure changes in pressure and relay this information to adjust these changes. Angiotensin and norepinephrine are involved with constriction of the vessels. Primary hypertension, or essential or idiopathic hypertension, has an unknown causation. It is the most frequent type of hypertension. Contributing factors to primary hypertension include inappropriate constriction or dilation of vessels, overactive systemic nervous system, sodium retention or excessive intake, increased body weight, diabetes, use of tobacco, and more than recommended alcohol intake. Secondary hypertension has a known causation and is often correctable. Risk factors include cirrhosis of the liver, narrowing of the aorta, drug-related effects, endocrine disorders, neurodisorders, pregnancy, kidney disease, as well as sleep apnea. Clinical manifestations of hypertension. Hypertension is often referred to as the silent killer due to the lack of symptoms at first. Many serious clinical manifestations are caused by organ damage secondary to hypertension. Symptoms include fatigue, dizziness, palpitations, chest pain, and shortness of breath. Due to the increased pressure, organ damage is the effect of hypertension. Causes coronary artery disease, buildup of plaque on the arterial walls, which narrows arteries, causing heart attack and chest pain. Left ventricular hypertrophy, which is an enlargement of the left ventricle. This causes the heart to work harder and uses more oxygen. Heart failure, due to the inability for the heart to keep up with the body's demands of blood, shortness of breath, fatigue are commonly associated with heart failure. Cerebrovascular disease, such as stroke, encephalopathy, cerebral edema, and in turn, brain damage. Peripheral vascular disease, due to the atherosclerosis, which is narrowing of the vessels. Kidney and liver damage, due to damage to small vessels and increased pressure. Diagnostic studies to monitor hypertension. Frequent and accurate blood pressure measurements is the most important start to monitor. Steps include identifying or ruling out secondary hypertension causes, evaluate organs for disease, assess cardiovascular risk, and get a baseline measurement. History and physical exam are an important part of this process, as well as urinalysis, basic metabolic panel, complete blood count, lipid profile, uric acid level, calcium, and magnesium labs. A 12-lead echocardiogram, or ECG, is also important. Caring for hypertension. Home blood pressure monitoring, including monitoring blood pressure while ambulating. Nutritional therapy, with emphasis on weight loss if overweight, reduction of salt, cholesterol, and saturated fats. Physical activity is important, as well as tobacco cessation, avoid excessive alcohol consumption, controlling stress, antihypertensive medications if needed, as well as further education regarding hypertension. Please take this time to visit the same link below this video and retake the quiz to see what you have learned.